Health Partners International of Canada, or HPIC, is a Canadian not-for-profit relief and development organization. And our basic mission is to improve access to medicines by working with partners around the world and in Canada, and to improve the quality of health care in developing countries. HPIC's starting business was that of providing medicine to developing countries, and that continues to be a large part of what we do. The medicines that we send are provided to us, donated to us by Canada's healthcare companies.
We are incredibly grateful to the Canadian pharmaceutical industry and the healthcare product companies out there who recognize that there is a need around the world, and they choose to partner with HPIC in helping to meet that need.
We work with a variety of NGOs that are based here in Canada. Some are Muslim, some are Jewish, some are Christian-based, small, big, in a variety of countries.
HPIC and VHFTA have partnered together to assist the Howard Hospital in Zimbabwe. So we partner together several times a year to facilitate large-scale shipments of medical supplies and pharmaceuticals to the hospital, which has enabled it to remain one of the only fully functioning healthcare facilities in Zimbabwe that's servicing a catchment area of close to 300,000 people.
We've been able to make medicines available to Howard Hospital on a consistent basis, working with a number of partners, including other organizations such as VHFTA. And this means that Howard has the most complete range of medicines of any hospital in the country. At its origin, HPIC focused almost exclusively on relief work, sending medicines to areas in need. Over the past few years, there's been a significant evolution in the work we do, and we've become more and more a development organization, which means that we're working in long-term sustainable development, trying to effect and help effect changes in healthcare structures and healthcare systems in the developing world, so that even after we have finished our work and have left, the changes will continue because they will be systemic changes at a ground level. And that's taking more and more of our energy and becoming a more and more significant focus for us.
Recently, I've just returned from Haiti after visiting some of our NGO partners and looking at what they're doing in light of what's happened with the earthquake. Absolutely incredible the amount of work that they are doing, and knowing that HPIC coming alongside of them, in some cases being the only agency that provides their medicines, making a huge difference.
1 out of 3, if not in a place like Haiti, 1 out of 2, like half the population of Haiti has no access to essential medicines. They cannot get medicines for free unless they're very lucky, going to a mission hospital in rural Haiti. In urban Haiti, most poor Haitians have no access to essential medicines. Without HPIC product, which is freely offered and freely given, I would be virtually useless in Haiti without the physician travel pack.
Our physician travel packs are put together by a group of volunteers. It's 2 boxes of medication that can be hand carried by a physician. He can basically take those boxes to the airport and have them put together and put into the belly of the plane. When he gets off the plane on the other side, he can pick them up and he's ready to go.
Our largest sustainable development project is a project in Afghanistan. There are basically 5 key components to the project. One of them is the provision of medicines. Donated medicines with a value of $25 million will be sent to Afghanistan. We'll be working with the government, the Ministry of Public Health, to develop a central donations office so that the Ministry of Public Health can properly manage medicine donations to the country. A third goal will be to work with the government's Public Health Ministry in supply chain management to ensure security of medicine inventories and that medicine is properly distributed. And finally, feasibility study to see what are the possibilities and the ramifications of the redevelopment of a domestic manufacturing industry so that key medicines could be made right in Afghanistan and the country would not have to rely on donations from outside going forward.
Thanks to HPIC, I have been useful, and I'm just one little player in Haiti. Hundreds of doctors go overseas with physician travel packs every year, providing essential medicines to where they're desperately needed.